Good evening, everyone. Welcome to our workshop tonight. I'm your MC, Maggie. On behalf of Mental Health Mutual Aid Hub Canada, I'm delighted to welcome all of you to join us. And tonight, we are honored to have Dr. Andrew Kim, the main speaker of today's workshop, to talk about video game addiction, which has become an increasingly recognized public health concern. Before we get started today, considering the diverse backgrounds of our audience, especially for those whose native language is not English, please allow me to introduce our Mandarin channel in Mandarin. 大家晚上好，欢迎大家来到由 MHMH 主办的讲座。我们今天很荣幸邀请到了 Andrew Kim 博士为我们进行网瘾和心理健康的主题讲座。由于今天的讲座是英文讲座，我们邀请了专业的口译员 Ida 为我们进行翻译。接下来我会向大家介绍如何进入我们的中文频道。如果是用电脑加入 Zoom 会议的观众，如图所示，请在界面下方的菜单栏找到地球图案的标志，然后点击中文或者英文叫 Chinese， 就会进入中文频道。我们的口译员会在中文频道进行实时翻译。进入中文频道后，同时也请大家点击 Mute Original Audio， 也就是将原声频道静音，这样嘉宾说的英文和翻译员说的中文两道声音就不会打架。也就是说，在中文频道点击将原频道静音后，就只会听见翻译员的声音。如果使用手机加入会议的观众，也如图所示，先点击一下屏幕，找到下方的菜单栏，然后找到3个点，点开找到传译，英文叫 interpretation， 然后点击，然后选择中文，并同时选择将原始音频静音，这样我们的操作就完成了。我们的工作人员也会在聊天框滚动发送教程。由于时间关系，我们先进行下一个议程。Okay, let's get started. First, I would like to express our sincere gratitude and warm welcome to our special guest tonight, Leon Fernandez, the Vice President of Ontario Operations for the Canadian Red Cross. Leon, we are thrilled to have you here for this exciting event. Would you be willing to share a few opening remarks expressing your support for tonight?
Absolutely. Thank you. Thank you so much for the invitation. I'm very pleased to join you today. We are grateful as the Canadian Red Cross to the Government of Canada for its investment into the Community Services Recovery Fund that is providing $400 million to support charities and nonprofits across the country. Over the past 3.5 years, we have lived through an unprecedented time. We have learned a lot, and thankfully, we are moving forward. Thanks to the Community Services Recovery Fund, the Canadian Red Cross is distributing grants to nearly 5,500 charities, nonprofits, and Indigenous governing bodies across Canada as they rebuild and recover from challenges faced by the pandemic. Now more than ever, these organizations are playing a key role in addressing persistent and complex situations faced by many in their communities, and have shown impressive creativity and stamina in the face of adversity. It is this important work that demonstrates the power of humanity in communities across the country. The Canadian Red Cross is proud to support the Mental Health Mutual Aid Hub Canada in Don Valley North with their 3R volunteering strategy, recruitment, retention, and realization. This project aims to build a sustainable framework to modernize and adapt after the COVID-19 pandemic, including comprehensive recruitment, training, promotion programs, supported by culturally focused training materials to increase recruitment, retention, and engagement. Thank you to the Government of Canada in helping organizations strengthen, adapt, and become more resilient in our post-pandemic world. And on behalf of the Canadian Red Cross, I want to say thank you to Mental Health Mutual Aid Hub Canada, for the important work that you do each and every day to serve the Chinese Canadian community in North York with psychological support services. At the Canadian Red Cross, we are pleased to be part of this funding process. Thank you.
Thank you, Lian. Really appreciate your kindly speech. Next, we have our Executive Director, Lydia Yang, from the Mental Health Mutual Aid Hub Canada.
Can you hear me now? Can you hear me?
Yep, we can hear you.
Okay, great. Good evening, everyone. Thank you for joining us as we come together to acknowledge and celebrate the significant progress we've achieved through the Community Services Recovery Fund provided by the Government of Canada. A special thank you to Lian for gracing us with your presence and for the exciting announcement. Your support is truly appreciated, and your dedication relevant with the shared mission for the healthier and stronger community. In my capacity as Executive Director of Mental Health Mutual Aid Hub Canada, I'm proud to share that our mental health peer support programs have become a crucial resource for Chinese Canadian community, especially in navigating the challenges posed by the pandemic. The recognition and the support we've received from the Community Service Recovery Fund have become instrumental in propelling our initiative forward. I'm particularly grateful to our dedicated team of volunteers whose commitment and passion have been the driving force behind our success. This funding has played a fundamental role in establishing a sustainable, culturally responsive volunteer training framework, complemented by an ongoing supervision and coaching system. This enhancement empower our staff and volunteer teams to deliver timely and effective mental health support services to the Chinese Canadian community. Through preventative intervention strategies, we aim to reach individuals who are struggling but may not seeking support due to stigma, cultural nuance, and language barriers. On behalf of Mental Health Mutual Aid Hub, I extend our gratitude to our founders, the Government of Canada, the Canadian Red Cross, Community Foundation of Canada, and United Way Canada. And a special thanks to our speaker tonight, Dr. Kim, and the interpreter, Ida, and our community partners, and all those dedicated to the well-being of our community. Together, we are charting a force towards mental health resilience and recovery. Thank you.
Thank you, Lydia. I believe it's going to be a rewarding night. Again, I would like to extend my gratitude to all the speakers and the audience who joined us tonight. And I believe the moment is worth capturing. So now it's photo time. One of our staff will make a screenshot, and if any of our audience would like their camera to open and show their lovely face, that would be perfect. So Mickey, when you're done, just give me a thumbs up. Thank you.
Okay, everybody, now please camera on, and I will count to 3. Okay, are you ready? 1, 2, 3, cheers. Okay, can we, one more, please? Okay. 1, 2, 3, cheers. Okay, Thank you.
Okay, fantastic. I'm sure everyone's eager to soak up some knowledge now. For the coming hour, I will hand it over to Dr. Li Jiayang and our distinguished speaker, Dr. Andrew Kim.
Okay, so thank you, Maggie. It's my great pleasure to introduce today's speaker, Dr. Andrew Kim. Dr. Kim used to be my colleague at the Toronto Metropolitan University, but last year, he accepted the offer of Canadian Research Chair and joined the Department of Psychology, University of Alberta, the University of Calgary. And there he is like assistant professor. He's a registered clinical psychologist in Alberta and Ontario. And he's also affiliated with Royal Ottawa Mental Health Center. And he is viewed as a rising star, at least from my perspective, and because he has a rapidly growing research and a grant record. And I don't know how he made it, but somehow he managed to really achieve a lot. So Dr. Kim will share with us today his research and clinical expertise in addiction, video game addiction specifically, and co-occurring mental health problems. Without further ado, and please join me to welcome Dr. Kim.
Thank you so much for the wonderful welcome, Dr. Yang. I am really excited to be here today and just want to again thank the Mental Health Mutual Aid Hub of Canada for inviting me and for everyone taking the time on a Friday evening to learn about video games. As Dr. Yang mentioned, I'm an assistant professor at the University of Calgary. But before that, I was at the Toronto Metropolitan University, and I still call Toronto home. And so it's a pleasure to be able to present to you today. So I'm going to share my slides. Just give me 1 second. And can everyone see my screen? Yep, all good?
Yep, all good.
Wonderful. So let's get started. So before I start, I just wanted to say that I was a huge fan of video games growing up. If you asked my mom, she might have probably said I might have been addicted to gaming. I don't think that's true, but that just goes to show you that gaming was something that I really enjoyed. And so on the screen you see here is a screenshot from Super Mario 64. I used to have an N64 growing up, and I have a lot of great memories playing video games. I never let it interfere with my school or any other activities that I had to do. But to be honest, if I were to say what would be my favorite recreational activity or the thing that I would like to do for fun, it would be video games. I don't play games as much as I do today, but I do still play video games here and there. And so what I want to do today is to provide an overview, an outline of what video games are. So what are video games? I'm pretty sure we all have an idea what gaming is, but just so we are on the same page, I'll start by defining what video games are. Then I'm going to talk about what is video game addiction. Now, I know, as Dr. Yang mentioned, gaming addiction is a growing public health concern. It's becoming increasingly recognized as an addiction among researchers as well as mental health professionals. So I want to be able to try and differentiate when is gaming potentially addictive and when is it sort of normal or fun. Then I'll provide a brief overview of what causes video game addiction, differentiate again from what's normal gaming and potentially when it becomes an addiction. So what are some signs we could look out for that is telling us that my video gaming might be becoming problematic? Understand the signs and symptoms of video game addiction. And then I will end briefly describing what are some of the treatment options that are currently available if you or anyone else you know that might be struggling with the gaming addiction. So let's start by defining what video games are. Simply put, it's an electronic game where players can control moving pictures on a screen using buttons or a handle or even a mobile device. There are so many different ways to play video games today. You have computers, you have video gaming consoles, which are things like the Xbox, PlayStation 5, the Nintendo Switch. You can play them at home. You can actually play them anywhere with mobile gaming. And games are increasingly available on our mobile devices, which we carry with us pretty much every minute of every single day. When it comes to gaming, there are many different genres or types of video games. There are first-person shooters, there are massive multiplayer online role-playing games, there are cozy games, which is my partner's favorite type of gaming, there are platform games, there's sports games, there's probably over 20, 30, 40 genres or types of games. Now, the different type of games, and I will talk about this a little bit later on, they have different risks when it comes to video game addictions because they all have different features. And I'll talk about what are some of those features that may pose a greater risk for a video game addiction compared to other type of games that may not have these features. So let's go on a brief tour history of gaming. While video games were developed by university scientists in the 1950s and 60s, it was in the 1970s that they became available to the general public. And so this is when people could buy video game consoles, bring it to their home, and to be able to play it. What you see pictured here is the Atari. Now, Atari is one of the most well-known first video game consoles that were available. And in 1970s, it retailed for around $200, $199, which, and I looked this up today because I was actually very curious, it would be about $1,600 when we take into account inflation. So they were very, very costly. And as you can see from the pictures here, they were kind of basic. The graphics weren't very good. They were a bit pixelated. The storylines were pretty basic as well. I mean, most of our phones can run something a lot better than what this $1,600 device could have ran back in the day. All right, so from when Atari was available, there were a few other pretty big milestones. So in between the two, from 1970s to 1980s, you had the Nintendo NES system and the PlayStation 1. This is when gaming became more advanced and more sophisticated. The graphics improved, the storylines got better, but it's really in the 1990s where you see a really, really big jump. This is where you see the 3D gaming becoming very popular with Nintendo 64, with PS2. The graphics improved substantially, and the storylines got a lot better. And so people could get attached to the main story. It became more adventurous. It became more sophisticated. And you skip to today, and you have the modern area of gaming, which is defined by high definition, very realistic graphics. And it's really evolved since 1970s when the Atari first became available. And so video games kind of look like this today, right? On the left, you have the PlayStation 5. Myself and my partner, we have a PlayStation 5. On the right, you see a computer gaming station. So some of you or some people you may know may have a gaming setup where you have these really high-tech computers, really great screens, and they have this whole elaborate setup that allows them to immerse themselves in the game. And at the bottom, mobile phones, right? Gaming is becoming readily available on our handheld devices. Here's a picture of this hyper-realistic graphics of modern video games. It really, you can see the detail. It really feels like you're maybe watching a movie, and it helps us feel more into the game and being in the game. Today's gaming is not just something you do at home by yourself. You can connect with players all over the world. People can build clans, they can make teams, you can play with your friend who might be in China while you're in Canada. You can communicate with others, and there's a huge online community of gamers. So it's really become a global social connected activity. Video games are still evolving. Right now, one of the big advances are VR gaming. So that's virtual reality. And you could actually buy virtual reality headsets and play VR games at home and in other places as well. So it's really helping with that immersive experience where you really feel like you're in the game itself and living the stories. Another big advance that's happened is the world of esports or electronic sports. Esports are video game competitions between multiple players or multiple teams. And think of a traditional sports like hockey, like baseball, like basketball. And now electronic sports is becoming really huge, and they sell out stadiums. So the League of Legends had 45,000 people pack into a stadium and watch esports athletes compete in these games. And esports is worth over $1 billion. So there are some people that can actually make a living being an esport athlete. Universities have esports teams, and some universities also offer scholarships. And so University of Toronto, for example, I remember offered an esports gaming scholarship. So as you can see, it's becoming really big and really mainstream. And this slide just highlights the popularity of video games. So in 2015, so not even 10 years ago, there were about 2 billion gamers worldwide. In 2023, that estimate has jumped to about 3 billion gamers worldwide. And so that's not quite half of the world's population, but about 40%. So as you can see, a lot of people play video games. And there are differences among where video games are popular. It might not come as a surprise to a lot of us here, but in Asia, China, Korea, Japan seems to be the region where video games have become really, really popular. And so in Asia Pacific, there's 1,789 million gamers, which is about 53% of the entire population of gamers worldwide. So it is a very popular activity, not just in the rest of the world, but in Asia especially. So as part of my research, I study addictions and mental health broadly. So while gaming is something I study, I also study gambling, alcohol, cannabis. And for the past 2 years, I've been involved in a large study that's trying to look at sort of the risk factors and prevalence of different types of addictive behaviors across Canada. And this is the second year we ran this study. And so this data is what I'm presenting for the second year, the one we just collected. And for this, we had over 3,000 university students recruited all across Canada and over 1,000 community adults. And we asked them questions about what type of addictive behaviors do you engage in? Do you drink alcohol? Do you smoke cannabis? Do you play video games? Do you gamble? As well as different mental health indicators. But for this, I'm just going to present the data for the different types of addictive behaviors. And what I just want to highlight here is that for the past 2 years in a row, when we asked them about what type of potentially addictive behaviors they engage in, gaming was by far the most popular. And so that's among adults and students as well. So in our sample, 81.3% of adults that we recruited said yes, they have played games in the past 12 months. And this was higher than alcohol, where 78% said yes, I've drank alcohol in the past 12 months. Student sample, 71% said yes, I played games over the past 12 months, and 75% said they drank alcohol. So as you can see here, in terms of addictive behaviors, gaming has one of the highest popularities. And so what does the typical gamer look like in Canada? So who plays video games? And so the typical gamer these days tend to be about 34 years old, so roughly around my age. However, people from all age groups, so younger age groups, older age groups, they all tend to engage in games. It seems to be a bit more popular among younger people, so in the teens and early 20s. On average, they play about 8 hours per week, so just over an hour a day, and people tend to play about 8+ games. And it's also popular among both men, women, boys, girls, and all different ethnicities. So it's really becoming very popular. When I played, it used to be sort of like a nerd, right? So not as popular. People say, oh, you play games, you must be a nerd. But today, almost everyone plays games. If you ask people, have you played video games, and you ask mobile phones as well, you'll get a lot of people saying yes, that they do. And there are a lot of different reasons why people play video games, right? Some people play because it's challenging, it's competition. Some people play for social reasons because they can meet their friends and they can talk to them online. Some people play because it helps them cope with stress, with anxiety, with depression. And so there's a lot of different reasons why people may play video games. And so just to summarize sort of the introduction to video games, it's evolved. There were very basic, pixelated, and now today, you can even play virtual reality games where you really immerse yourself in this environment. It's become very popular of all ages and all cultures. Gender, it's no longer just an activity that only a select people do, but generally speaking, most people play video games. And it's been increasing year after year. In fact, I didn't mention this, but the industry, the video gaming industry, generates more revenue than Hollywood. It's become a billion-dollar industry. It's really massive, which kind of, again, speaks to how popular they've become. Most people will play multiple games a year, play an average of 8 hours per week. Okay, so talked about a lot of people play video games. It's becoming very popular, but not everyone develops an addiction to video gaming. And so the question becomes, one, how do I know when my gaming might become an addiction? Two, why do some people develop a video game addiction while others don't? And so for the next little while, I'm going to be talking about what video game addiction is and what are some of the risk factors, and talking about how do I know, or what are some of the signs that might indicate that I might have a problem with video game addiction. Okay, so video game addiction as a mental health disorder is actually fairly new. It was included in the DSM-5 in Section 3. So Section 3 is for mental health disorders that are emerging, so that are new. but may not have as enough evidence to formally include them as a psychiatric diagnosis. But DSM recognized that gaming addiction is a growing concern. There is pretty good evidence, but not enough yet to be able to say, yes, gaming is an addiction, so we have to include it in. That said, ICD-11, so DSM, the Diagnostic Statistics and Manual of Mental Health Disorders, is used in North America. The ICD-11, which is the International Classification of Diseases, is used pretty much elsewhere around the world. And ICD-11 in the latest edition, which came out around 2019, 2020, included gaming addiction as a mental health disorder, similar to that as an alcohol addiction, cannabis addiction, or gambling addiction. So it recognized that, yes, video gaming can cause an addiction, and it shows similarities to alcohol, cannabis, and gambling. And so if we talk about video game as an addiction, it's only been about 3 or 4 years where it's been officially recognized as the mental health disorder, but we've known about potential for gaming addictions since the 90s. So what are some criteria for video game addiction? How do I know if I'm addicted? And so the DSM-5 defines video game addiction using 11 different symptoms, and you need 5 different symptoms to be met over a course of a year to be diagnosed, or saying that, yes, I meet or they meet criteria for video game addiction. And I've just taken the different symptoms and I've grouped them into these 4 main domains. The first area is impaired control. And so this is when people have difficulty stopping or controlling their video games. For example, they have tried to reduce the amount of times. So it's saying, I'm only want to play 1 hour a day, and they're unable to do that. They might have tried to stop for a month, but they found that it was very difficult. So when they've tried and they weren't able to stop or cut down on their video gaming. The other one is preoccupied. And so this means that you're always talking about video games, thinking about video games, thinking about when you can play next. So it kind of takes over your life a little bit. The other big area is social impairment. And so video gaming has started to cause problems in your life. It's left with you've lost your job, or you've been in trouble because you couldn't show up to work because you were staying up all night playing gaming. You're not doing as well in school. You miss exams. It's interfering with your studying. It's becoming problematic with your friends, with your family. So starting to interfere or cause harms in important areas of your life. Risky use, continue to game despite having some of these problems we talked about, and physical dependence. Now, I will say that there is debate still whether people can be physically dependent to gaming as they could for alcohol, cannabis, or other types of substances. There is some support. People might become psychologically agitated, so irritable, angry, depressed, anxious when they stop gaming. They might need to play more and more and more to get the same kind of feeling. But it's still not 100% clear whether gaming can result in these physical symptoms as alcohol or other substances can. And so of these, you meet 5 symptoms and they present for a year, and that would be sort of an official diagnostic for a gaming disorder. ICD-11 is a little different when it comes to what the criteria for gaming addiction is. The main criteria is 3. So it's got that impaired control. You can't stop gaming. You've tried to cut down. it's gaming is starting to become sort of the most important thing in your life, and despite all other activities, you prioritize gaming over everything else. You prioritize gaming over school. You prioritize gaming over work. You prioritize gaming over your relationship with family and friends. And your gaming continues to go up or escalate despite having some of these problems as well. So you need more and more and more and more. And your gaming has started to cause problems for you. And so these 3 symptoms must be present, or you must experience this for 12 months and cause you some distress, or it's causing problems in other areas of your life. And so that is sort of the main diagnostic criteria to be classified as having a gaming addiction. But of course, people may not meet all the criteria, but they could still experience some symptoms or experience some harms of gaming addiction. So let's talk about how common is video game addiction around the world. And in terms of the best evidence we have to date, what the research shows is that gaming addiction is around 3%. So it's actually fairly high. It's more than gambling, not as high as alcohol, but it is fairly common when we talk about addictions. In Canada, it's about 3.2% of the Canadian population would meet criteria for gaming addiction. US, 2.7. Europe, roughly same, 2.7. China, 4.7. Again, in Asia, rates of gaming addiction tend to be higher. And Australia is around 3.2. Global average, 3%, but there are a bit of variations, differences when it comes to the rates, with Asia, in particular China, having some of the highest rates that we've seen. And going back to that large study of addictions that I'm part of, or that I'm leading, gaming addiction is also the most frequent problem that we see. In adults in our sample, 1/3 meet the cutoff. Again, this isn't a representative sample, but when we compare it to the other types of addiction, it tends to be the highest. So 33.5% of our sample and 27.2% of students meet that cutoff, suggesting that they may have a problem. So it is fairly high, and it's one of the most common addictions that we see. So 80% play video games, right? 80 to 90% of people play video games, yet if video game addiction is seen in maybe 3 to 10%, how do those 3 to 10% differ compared to the majority of people that play video games but aren't addicted? What are the different risk factors? And from our research and from the literature, what we see is that the risk factors of video game addiction is very similar to the risk factors of other types of addictions. They are biological, so things like how your reward systems in the brain operate. Potentially, there's a familial history, a family history of addictions. So there is some biology that has been shown to increase the risk, whether someone may be addicted to gaming while others aren't. Psychological, so anxiety, depression, trauma, we know can be a risk factor for addictions, and social risk factors as well. Quality of relationships, loneliness, exposure to gaming, and all these factors interact to increase the risk that someone may have a gaming addiction. It's very complex. And so even if you have a biological vulnerability, so a family history of addictions, it doesn't mean that you are going to be addicted to gaming. It's just going to increase your risk. So the same risk factors that will increase the chances someone may be addicted to alcohol is what we see to be similar risk factors of what someone may be addicted to gaming addiction. And so in terms of the literature and the studies that we've seen, here's a summary of what may increase whether someone may be addicted to gaming. One of the biggest ones that we see is if people play video games to cope or escape from real life. So they play video games because it helps them manage their depression, helps them manage their anxiety. So if it's used to help with your mental health, we know that can be a risk factor for addictions. What we constantly see is that being male and people who are younger tend to be more likely addicted to video games. If you are experiencing depression, anxiety, ADHD, autism, trauma, that seems to increase the risk of gaming. Stress, so more stressed you are, more stress you experience, that increases the risk. Neuroticism, so high anxiety, and impulsivity, these tend to be pretty strong risk factors of addictions. What decreases risk that we've seen in the literature for gaming, it includes things like high self-esteem. So you feel really good about yourself, you feel good in your abilities, you feel good in your competence. If you're satisfied with your life in various aspects, so you're happy with how school is going, you're happy with how work is going, you're happy with your relationships, that will increase risk. Higher education, higher intelligence seems to decrease the risk as well. And things like extroversion, conscientiousness, agreeableness. Extroversion is how social you are, how outgoing. Conscientious is just how much you not follow rules per se, but you're just very considerate. You're mindful of time, you're on top of things. And agreeableness, again, how friendly you are, they all seem to decrease the risk. Now, I mentioned that in addition to sort of the personal factors and the social factors, there are different types of games that may have greater risk for gaming. And we call these structural factors. So these are things about video games that may increase the risk. So in studies that we've done, what we've seen is that games that have high degree of social features, so multiplayer games where you're able to chat with others in the game, there's high degree of social interactions, they seem to have a greater risk of gaming. Narrative and identity, so having a bigger stories, a story that you can really get drawn into, that seems to increase the risk as well. Depending on how much control you have, so being able to save games, being able to control what you look like, so you're designing your video game character, that seems to have a greater risk. Presentation, so these are things like realistic graphics, sounds, they also tend to increase risk. And reward punishment, so a lot of gaming now includes gambling-like features like loot boxes. We know that those could increase the risk of gaming as well. So one of the biggest questions we have in the study of video game addiction is, when is it a recreational activity? So when is it something I do for fun and that I really enjoy? And when is it an addiction? Right? And this is an ongoing debate in the literature. So again, one of the things that I want to highlight here is that unlike other substances, time spent playing video games may not be strongly associated with problematic gaming. It is associated. So what that means is that more time you spend playing games, the higher the chances you are to experience an addiction. But it's not as strong as other addictions, let's say like alcohol. So for example, if someone is drinking 3-4 hours a day, there's this greater risk that you may be experiencing alcohol addiction. If you are playing video games 3-4 hours a day, it's not as strong as having that addiction as it is with alcohol. There are a lot of different factors that go in. And so, one of the things I often hear is that I play video games for 3 hours. Am I addicted? Maybe, but maybe not. There's a lot of different things that go into trying to understand whether someone be experiencing an addiction or not. So let's talk about some of those symptoms. What are some of the early warning signs that may suggest that someone is addicted to gaming? And these are 2 studies that I've recently been conducted, and it's with people with lived experience with gaming. And so again, this is part of a larger study looking at symptoms of addiction among people who have actual experience with addiction. And here I'm going to highlight gambling, alcohol, and video games. So what we did is we recruited adults across Canada, and we asked them, have you had a problem with any of this 6 types of different addictive behaviors? Did you have a problem with gambling? Did you have a problem with alcohol? Do you think you have a problem with cannabis? Do you have a problem with video gaming? And if they said yes, we asked them, what's the sign or symptom that you think is important that let you know that you had a problem or that you were addicted? And so as you can see, we have 405 people that said, yes, I'm addicted to gambling. These are some of the symptoms and signs that were important. 548 said, yes, I had problems with alcohol. These are the signs and symptoms I thought was important. And then 200 for video games that said, these are the signs and symptoms that I thought were important. The sample is roughly about 50 years of age, 43% women, 56.5% of men. And what we really did is that we took their open-ended responses and then we categorized them and we sorted them into common themes. And this is what we found. So one of the things that I want to highlight here is that the most common symptoms and signs, regardless of addiction, were things like dependence, and these are the DSM-5 symptoms. Things like loss of control, so being unable to stop gaming. Preoccupation, being always thinking about gaming. Patterns of use, so these are things like I have to game as soon as I come home from school, or I stay up all night gaming. And these were the same that were similar across the different types of addictions. And so here are some of the actual responses from people that had gaming addiction. And they said things like they were very moody when interrupted and when not playing video games. They're playing all night. They couldn't separate reality and fantasy, interfering with relationships, negative consequences at work and school. And so what we found was that although dependence and patterns of use were the most common, with gaming, they said, yeah, it interferes with life more extent than alcohol and gambling, and it was causing a lot of problems. One of the one of the responses that we saw was someone saying, I knew it was a problem when I was getting into argument with my girlfriend about how much time I'll spend gaming and not spending with her. And so in a follow-up study, we again wanted to recruit people that had personal experience with addictions and ask them, what do you think caused you to be addicted to gambling? What do you think caused you to be addicted to alcohol, cannabis? What do you think caused you to be addicted to gaming? And so we recruited 1,200 people, and they told us what they thought, again, was the reason they're addicted to different types of addictions. And one I would like to highlight here is that the most common reason across gambling, video games, and substances was that coping. So gaming with friends was something that came up, but trying to escape the day-to-day realities, childhood problems unresolved, anxiety, and low self-esteem. And so what they were really saying is that what I think caused me to be addicted to gambling, gaming, and substances was because it helped me feel better for my mental health. So it helped me manage my depression. It helped me manage my anxiety. It helped me manage my stressful life. Now, I say managed because with any addiction, gaming works in the short term. So in the moment, it could help, but it's a maladaptive coping strategy, meaning it's an unhelpful coping strategy in the long run. It's got a lot of negative consequences associated with it, and it's not what we would typically think of as a healthy form of coping. It can be, but what we're seeing here is that it's an unhealthy form because although it helped them with their anxiety, with their depression, now they're saying, yes, I feel like I'm addicted to gaming, and gaming is also now causing its own problems. So just to summarize, when is gaming potentially a problem? So when do you know it might be becoming an addiction? Regularly exhausted and disengaged, that's from staying up all night. Struggling to concentrate at school or at work, again, because you're preoccupied. So gaming is the thing that you think about most often. You might have spent all night playing games, so now you're tired at school for work. You might have played games even though you had a big test coming up. You prioritize games over other important activities. So it could be school and work, but it could also be sports. It could also be friends. It could also be family. So not going out to see your friends to socialize because you want to stay home and play games. You might have soccer practice, or your friends invited to play basketball, but you decline because you're gaming, and you might be missing a lot of family events, dinners, because you're spending a lot of time gaming. And so you can see gaming now becoming sort of the center of your life. Has tried to cut down or reduce, and you're unable to. So that's one of the signs that could be a big sign that it might be becoming problematic when you can't control it. And the other sign to look at, if your social activity or it's the only thing you do outside of everything else. So again, it's becoming sort of it's becoming the biggest thing in your life, essentially. So just summarize, internet gaming disorder is now recognized as a mental health disorder. So it's in the ICD-11, so it's becoming more increasingly recognized and validated among healthcare professionals. Playing video games for long periods of time may or may not equal gaming addiction. So it's not the only thing we should look at to see whether someone is addicted or not. There are a lot of different things that may increase the risk or cause gaming addiction, and it includes both individual factors as well as the actual game itself, so the features in a game. And there are also similarities between gaming addiction in terms of the signs, symptoms, and causes compared to other types of addictions like gambling, alcohol, and cannabis. And so just to finish off, I'm just going to talk about, so what can you do? What are some of the treatment options that are available for video game addiction? I will just want to note that the research into the potential treatments of gaming, it's limited. So it's still really early, but there is some evidence to suggest that there are a few things that may help. And the first thing that I want to talk about is cognitive behavioral therapy, or CBT for short. CBT is the best psychological treatment we have for other types of addictions like alcohol, cannabis, and gambling. And there are studies that show really good promise to be able to help for gaming as well. So in CBT, the premise behind it is that how we think, our thinking really affects how we feel, and it affects what we do. An example of this is that 2 students can receive B pluses on the exam. One student could be extremely happy about receiving a B plus, but another student could be extremely sad, extremely down with the B plus. It's the same grade, yet 2 different reactions, and that's based on what they think about that grade. So someone could say, I studied really hard. I know I wasn't doing well in the course, so B plus is a great grade. Someone might thought, I studied really, really hard. I thought I got an A plus. I really don't get this material. So they may feel really down on their ability and their competence for the course. And so in CBT, we try to identify what are some of these unhelpful thinking patterns that people may have, and to help them think more adaptively or more helpful about it. And so our emotions are connected to our thoughts and are connected to our behaviors. So when someone seeks treatment for gaming addiction in a CBT framework, they'll learn about what video game addiction is, what causes gaming addiction. They'll learn about understanding the triggers and function. So why do you game? What does gaming provide you? And what are some of the things that trigger you to game more often? It might identify some of those unhelpful thinking that may be leading to more gaming. It will help people develop ways to better cope with their anxiety, depression that may not involve gaming. Problem solve and have strategies to reduce gaming, if that is things like putting a time out, asking your parents or your friends to limit the amount of gaming, and just generally helping us to better cope with our negative emotions. The other treatment that's found to be effective for addictions that has now good promise for gaming is something called motivational interviewing. Motivational interviewing is a technique that is collaborative. So you work with the client, but it really helps them to increase their readiness to change their behavior. And with addictions, we know that there is ambivalence, meaning people aren't sure whether they want to quit, whether they want to stop. And that is very common when it comes to alcohol, gambling, or gaming. And so it's to help increase their readiness to really explore what gaming means to them and try to get them to a place where they feel like they're ready to reduce or stop their gaming. And what's really important to understand from motivational interviewing is that people are at different stages when it comes to if they want to quit their gaming or not. So for example, someone might be at the pre-contemplation stage. This means that no, they don't see gaming as a problem, and they're really not thinking about quitting gaming. They have no thoughts about quitting or reducing gaming because, again, they don't think it's a problem at all. So why should I quit? The next stage is contemplation, which is, yeah, I might want to reduce the amount of game. I really got a bad grade because I couldn't study, and they're starting to kind of see some of the negative consequences, and they're thinking about whether they should game or not. Then they start to come to a decision, determination, or preparation. They said, you know what? I think I'm going to reduce the amount of time I game. I notice it's causing me some problems. I still enjoy it, but I'm going to try to do something about it. Then you have the action stage where now they're actually taking steps or strategies to actively reduce the amount of time they game or stop. In addictions, it's fairly common for people to relapse or go back. And then if they're successful, they enter a phase called maintenance where they were able to successfully stop or reduce their gaming. And it's sort of a cycle. So people can move between the stages. And MI recognizes this. So for example, if I know that I have a client who's not thinking about gaming, or thinking about stopping or quitting their gaming, I'm not going to talk to them about strategies to help stop their gaming. That just means they're going to argue back with me. right? So imagine someone tells you to stop something you don't think is a problem. Our natural response there is to argue back why it's not a problem and why I'm not going to stop. And so MI sort of works within that framework and meets people where they're at. And just a brief note for abstinence and harm reduction. So to control your gaming or to reduce it, it may not be necessary to quit gaming altogether. And this goes for other addictions as well. And so you have this arrow here. Abstinence just means you're not doing it. You're not gaming, you're not gambling, you're not drinking alcohol. And of course, that's sort of the safest level, but it may not always be necessary. And on the other hand, you have the harmful here. It just means that it's an addiction. With harm reduction approaches, we're trying to meet people around here, where yes, they're still gaming, but it's not causing problems anymore. We're trying to get them to a place where they can game, but they can do it without experiencing any problems. For some people, they have to quit. For other people, they may not have to quit. So it really depends on where you're at and what works for you. Just briefly, my colleagues and I, we published a study looking at medications for gaming disorder. And the summary is that we need more research. There aren't many high quality studies that looked at the effects of medications. And the medications that have been used are antidepressants, ADHD, and anti-anxiety medications that seem to be the most common. They were actually all studied in South Korean men. So there isn't many other studies on other populations. And so it's really difficult to kind of figure out what medication works or not. So there still need to be a bit more research when it comes to medications that could help. So say you feel like you might have a problem with addiction. What can you do? What can I do to help myself or reduce the time that I spend gaming? You can find other hobbies. So writing, reading, exercise, or think about what does gaming give me? Why do I like to game so much? And then what else can do that for me? You can set time limits on your gaming. I'm only going to play 2 hours after I finish my homework. I'm only going to play 1 hour when I have work, but I'll play 2-3 hours when it comes to when I don't have any other things I need to do. You can set attainable goals so you can reduce slowly. So if you're used to playing 6 hours a day, it might not be helpful to say, I'm going to stop altogether. It might be reducing it to 4, then 3, then 2. You can tell other people. You can get support from your family and friends. You can find a therapist. There's also support groups that help people who are also trying to overcome their gaming. You can also write out the pros and cons. So gaming can have benefits, but if you're at the stage of thinking you might want to stop or reduce, then it's also causing some harms. So think, what would be the benefit of me trying to quit gaming? What is it going to do for me? What can you do as a parent? If you're concerned about your child, your teen or loved one, and you think they may have a gaming addiction, what can you do? You can learn about video gaming. So learn about what it is, the different genres. What type of game does your child play? What do they like? So you can talk the same language. You can be supportive, right? Understand that gaming, they might see some benefits of gaming. So try to understand what gaming really does for them and some of the benefits. You can set limits, right? If you're a parent, you can set limits of how much time your child can game. You can organize other activities, family activities. And so just set some boundaries around gaming time. And family therapy has been shown to be quite helpful as well for children and teens that may be experiencing gaming. So just to summarize, gaming really, really popular, enjoyed by billions of people of all different ages, genders, and ethnicities. But it can also become problematic. So it can lead to an addiction and cause harms. And one of the things that might let you know you might be experiencing a gaming addiction when you try to cut down, but you can't, you prioritize gaming over other important activities, and it's getting in the way of other important things. Gaming addiction shares many similarities with other addictions like alcohol, cannabis, and in that way, the treatments that are available for people experiencing gaming addiction are similar to those of alcohol and gambling, things like cognitive behavioral therapy, motivational interviewing. And here I had some resources for those of you who are interested in learning more or would like to get help for problematic gaming or gaming addiction. And now, happy to answer any questions that you may have.
Hey, thank you so much for sharing, Dr. Kim. I have gained a lot of profound insights, and I believe everyone did too. So next, I think I'll first invite Kathy Lee, the coordinator of Mental Health Mutual Aid Health Canada, the outreach team, to introduce the organizer of tonight's event. And after that, we will have our Q&A session. Before we move on, Ida, please advise our audience to come back to our main audio.
那
Thank
请
you.
大家进入我们现在的现场。
Okay,
好。
perfect. And Kathy,
我已经
whenever
把
you're ready. Okay,
OK， 我已经把传译功能关掉了哈。
okay.
好的，谢谢大家的聆听。现在呢，我知道大家都有很多问题要问哈，所以我会做一个很简单的机构介绍。但是这个机构介绍呢，也是大家的需要，因为每个人都有获取信息、抱团取暖、共同成长的需要哈。那我来介绍一下我们的今天我们的机构，我们是加拿大心理健康互助中心。我们是在加拿大联邦政府注册的非营利机构。我们的使命是为正在遭受心理健康困扰，但对寻求专业心理健康服务有顾虑的人们，搭建一个心理健康的互助平台。所以我们是一个互助的平台。我们是很多的义工，你看大家这里哈，大概有100多位义工。我们在专业团队的支持下，我们的那个专业支持机构是 WCCYC 哈。在这个专业团队的支持下，自助助人，然后我们提供的服务全部都是免费的。那我们的服务呢，主要有3大块，一个呢就是预防、干预和治疗3大块。我先介绍一下预防的服务哈，我们在一起互相陪伴，抱团取暖。我们的预防服务呢，有我们的嘉华心理健康周刊，这个呢是给大家很多的这种心理健康的知识哈，给大家增加新的观点和角度。我们有专业的培训，有公益的讲座，今天就是其中之一了。我们每个月基本上都会做一次大型的讲座，我们也有线下的活动那大家都需要陪伴是吧？都需要一个社群，所以的话呢，我们有13个微信的大群，那请大家参加你关注微信公众号，然后呢在留言框里面打上你心仪的微信群代表数字，我们就会有小助手来加你进群啦。那你看这里呢，自助助人，你如果想加入我们的这个温暖的义工团队呢，你就打一个1那今天呢，大家可能很多人都对青少年支持有兴趣呢，那大家就打一个5，那就可以加入华裔青少年支持群了。我待会儿也会放那个入群的2维码出来那我们有这个留学生的热线留学生热线号码呢是289-800-8818。我们的服务时间是周1到周6的加拿大东部的时间1点到10点。那我们推荐呢，青少年及其家庭拨打的时段呢是4点到7点。为什么呢？因为那个时候青少年放学了哈。另外一个呢，就是我们在这个时段，我们是有一些有留学背景的这样的接线员来听的，那可能有更好的连结。这个留学路漫漫哈，但是我们每个人呢都不必独自前行。我们 MH 呢有这个留学生的同行计划团队，像今天我们的主持人 Maggie 就是这个同行计划团队的负责人哈。那这个同行计划呢，我们会提供小组的支持，就是一群青少年，我们在这里大家互相支持，有主题的一些的小组然后呢，我们更好的是呢，我们会提供 根据个人的情况为您呢匹配合适的辅导员一个 mentor 那进行1对1的线上支持。所以这些家长们呢，如果你们觉得孩子有需要的话呢，可以跟孩子商量一下那我们呢这个干预服务也包括1对1的免费国语心理支持，这个是在 Zoom 会议上进行的，是1对1的。刚才那个热线呢，是你1点到10点之间随时打进来，可能不同的接线员。但是呢，你如果想预约1对1的一个固定的时间的话呢，就请您扫描我们的公众号，通过公众号的小程序来预约报名了。反正总之，今天呢，你只要是关注了我们的公众号，你就找到我们了。我们也有小组因为其实很多团体治疗、团体的陪伴的力量是很大的，我们的小组也是非常受欢迎的现在呢有2个小组在进行中，一个是如何有效陪伴焦虑和抑郁患者，另外一个呢是关爱他人从我做起，那也是关注公众号，然后呢就在这公众号的小程序里面预约报名就可以了。那关于治疗呢，我们的这个治疗的我们的技术支持机构就是加拿大青少年心理咨询中心 WCCYC。WCCYC 呢为符合条件的人士，比如说低收入或者家暴受害者来提供免费的咨询。那这些所有的他们的服务他们网站微信公众号什么都在这上面了有需要的可以截一个码。那我们这一次的讲座呢，有2家合作单位，一个是哥伦比亚国际大学K 法学院。这个哥伦比亚国际大学呢，它是一间100年的老校，是在美国的一所的私立大学。那他们的学位呢，全部都是经过美国的权威机构的认证的，也是在中国的教育部来备案的一个的大学那这个大学呢，他们提供的是什么他们的 K 法学院呢，提供中文的互动教学，所有的教授都是讲流利的中文的那他们这个研究生项目呢有3个，一个是工商管理硕士，一个是临床心理辅导硕士，还有一个网络安全硕士。学费也是平民化的。那如果有兴趣的话呢，可以来这个扫码来关注一下跟他们咨询。另外一个我们的合作单位呢是 UCA Waves， 那是美国华人联合会精神健康项目。UCA Waves 呢就和我们 MH 有点像是这个姐妹的团体一样的，我们大家呢做的事情也很类似，我们就是致力于向华人社区来普及心理健康知识，帮助华裔的青少年应对心理健康方面的挑战培训青少年和成人精神健康急救员这是他们的一个特色所以呢也请大家关注他们的微信公众号，特别是美国的听众们那好了，那我的对，这个是我们现在的我放出来这个入群的临时群的2维码因为青少年群的那个可能快满了。那右边呢是我们的微信公众号，那左边呢这是我们正在如火如荼进行的一个征文活动。你在他乡还好吗？我们每一个人离开家乡到了加拿大或者到了美国或者到了其他国家，我们呢都是需要一个团体，所以我们在一起我们就不孤单。那这个征文呢的截止时间是到2月21号，那请大家关注公众号，也是在那里可以找到所有的资料。那我今天的机构介绍就到这里，谢谢。
谢谢 Kathy。OK， 马上就是我们的 Q&A 时间那我们在讲座开始前，在各个大群收集了很多的提问，那我们将最具有代表性的几道问题挑选了出来。那么在接下来的时间呢，我们的义工 Mia 会在嘉宾回答完每一个问题后，用中文去翻译和总结一下嘉宾刚刚的这些回答。 Okay, so Dr. Kim, we have collected some questions before the workshop from our audience. It would be much appreciated if you can provide some insights for them. In the meantime, one of our staff, Mia, will translate and summarize the response in Mandarin. Okay, here we have our first question. So what needs of children can online gaming satisfy, and what alternatives can parents offer to fulfill these needs?
Yeah, of course. And that is a very good question. And it depends. It really depends on your child and your teen. And so there are different reasons why people play video games. They might do it because for competition, because they like to compete against others. They might do it because it's a social activity, right? So it's where they connect with their friends, they meet other people. They might do it because it's just fun. It's entertainment, right? It's something to pass the time. So there are different needs that people might get from playing video games. And there are some research saying that some of the common psychological needs that people can fill through video games are things like the need to feel effective, so competent, right? To feel like you're good at doing something. Gaming could also make people feel like feel important to other people. So that social connection, that interpersonal relationship. And other things could be things like feeling the need to have control over some aspects. So there are different needs and reasons why children play games. It's finding out what is it? What do your child get from gaming? Is it social? If it's social, could the parent then facilitate other social activities that's not just centered around gaming? Is it feeling like they're good at something? Gaming is something they really excel at. So they might not be doing well in school, they may not be excelling in sports, but gaming is something they feel like they're good at. Is there other hobbies, other skills that your child can do that'll give them that same sense of, say, accomplishment or that same sense of skill and mastery? So it's really finding out what it does for them and then finding something else that's going to do the same thing. That's not gaming.
Hey, Mia, ready?
这取决于，我这背景会很吵吗？大家听得到我说话吗
听得到，可以的。
？OK，这取决于您的孩子，因为人们选择游戏的原因是很多的，比如说有竞争性，或者说他可以通过游戏社交，游戏可以使人们认为他们擅长某一类东西，并且对他有一定的掌控感。如果是社会原因的话，家长可以帮助孩子们社交；如果是竞争性原因的话，因为他们的感觉是可以通过游戏让他们优于其他人的。那么家长可以帮助孩子找到他们喜欢的其他事情。
OK， 好的，谢谢米娅。OK， next question. Next question is, if gaming serves as a coping skill, how can a 19-year-old with depression manage their gaming time, especially if they're not into sports or going out?
Yeah, that's also a really good question. So I say coping skills because it's not a helpful coping skills, or it may not be as helpful. And so for different type of addictions like gaming and alcohol, people say they drink or they game because it helps them manage their depression. But we call it unhelpful coping because it can develop into an addiction. And so we know that addictions and mental health are common. And if gaming is being used as a way to help with the depression, then it's one strategy is to help manage that depression, right? Through could be medication, could be psychological treatment, but is to address the issue that is leading someone to game excessively. So treating the depression along with the gaming at the same time. What I tend to see sometimes is that someone may then just treat the alcohol or just treat gaming without the depression, then they switch to a different addiction. So it's really helpful to manage the underlying cause, right? Again, if they don't like to go out or into sports, there's exercise, there's walks, there's reading, there's other potential activities that can fill the same need or function, is to find out what that is. But if it really is depression that is leading to the excessive gaming or gaming addiction, then I would say it'd be very important to also help deal with the depression too, and not just focus on the gaming.
第二个问题主要是，因为游戏不是一个有益的应对策略，游戏和酗酒不同的是，游戏会致瘾。那有一种方法可以帮助到孩子，比如说去做心理咨询，或者说找到其他适合他的方法开导他。游戏上瘾和治疗需要在同一个时间段进行。但是如果比如说您的孩子不喜欢外出，就可以选择其他潜在的方法帮助他们降低成瘾性。
对，我稍微补充一下哈，就是刚刚其实Dr. Kim 提到了一个很重要的一个点，在于说孩子首先就是他为什么会对游戏进行一个上瘾？那包括之前的 slides 里面也讲到，他可能就是他是应对这个抑郁症的一个方式，所以最重要的一点是我们其实不是要去管理这个游戏的时间，而是要去帮助孩子去把他的这个抑郁症给治好。因为就是很重要的一点是我们要去找到这个玩游戏它这个潜在的这个原因，他为什么要去玩游戏？那因为是要去这个解决他的抑郁情绪，或者是他的一些这个心理的一些状况，所以最好的一个方式，其实我们就是不要说去治标不治本啊，我们最好还是去治本。所以就是先把孩子的这个抑郁先给他缓解了，那这样子的话，其实也是能够帮助到孩子，就是去开始去探索一些其他的除了游戏之外的一些方式，因为如果我们不把这个抑郁治好的话，那他不去对游戏成瘾，他也会对其他的东西有一个依赖性，所以我们最好的方式还是去找到这个潜在的问题，然后去解决它。好的，and the next question is, a child is asking to play games for a bit after finishes homework every day. What's better for his mental and physical health? Like, what's the time? Like 2 hours or playing for 30 minutes or an hour daily? Is there any suggestions?
There is a suggestion. It's going to be, so there's general guidelines, but do what works for you and your family. But if you want general guidelines, what's been suggested is for kids over the age of 6, the American Academy of Pediatrics suggests no more than 1 hour on school days and 2 hours on non-school days. Kids under 6 should spend closer to 30 minutes. So that's the guidelines that the American Academy of Pediatrics suggests. Now, that may work for some, may not work for others. So it's figuring out what's the right amount for you and your kids. But if you want general guidelines, that's what people suggest.
在工作日的时候，在孩子6岁之后，建议的时长是小于1个小时工作日的。那在周末的时候，那个孩子的这个游戏时长建议是在2个小时之内的。
好的。Okay. And our last question. My 15-year-old son usually plays video games or surfing on the internet after he's dismissed from school. Then he's doing his homework for around bedtime. He told me 2 or 3 times, I didn't prepare for my exam for tomorrow. It seems like he feels bad about this habit, but couldn't manage his time, and he feels bad about it. Whenever he finds the math or social problems challenging for him, he easily slips into playing video games. How can I support him to change his this habits?
Yeah, I really like how the question is framed and how can I support him? And I think that's really important to parents to be able to help support their child. And I think most parents, all parents want the best for their child. So I really like how this was phrased. And I think one thing that can be done is flip it around. So homework first, then after homework is done, set aside time for games. Right? So instead of playing games first and then doing homework when you're going to run out of time, you do the homework first, then the game after. And in psychology, we call this the pre-MAC principle. So you do something that you don't like to do something that you like, right? Or so it's that way you can help better manage it. And if they're having difficulties with math or social problems and it's bringing up frustration and that's sort of what's leading to the gaming, then you could help support the child in helping to solve the math or social problems, right? Help them work through the problems and come to a solution together, which could help decrease frustration, but also help increase confidence, right? So switch homework first, then game, and then help them with some of those problems as well and help them work through it.
我认为大部分的家长肯定还是想要帮助到孩子的，但是在这个时候，我们就需要帮助孩子设立规定，就是要先完成家庭作业之后，再给游戏设定一定的时长。家长在这个时候起到的作用就是帮助孩子合理规划时间，并且与此同时，这个时候也同样锻炼孩子的就是微观、宏观的如何去解决社会性的问题，并且帮助他们提升自信心。
Okay. 谢谢 Mia. And thank you so much for your insights, Dr. Kim. I guess it's time to wrap up today's session. Once again, thank you all for participating, and I wish everyone a wonderful weekend. 我们的讲座到此结束，谢谢大家的参与。也欢迎各位关注我们的公众号，加入我们的社群，我们会持续举办贴合大家需求的活动。那么祝大家有一个美好的周末。
Thank you so much.
Thank you.
Thank you.
Thank you so much, Andrew.